welcome back to the U.S. Health Insurance series. In our first video, we broke down how health insurance costs are structured into fixed payments, your premium, and variable payments, your out-of-pocket costs. We also showed why it's important to view these side by side to understand your total annual medical expenses. In this second and the next third video, we're diving deeper into the details of health insurance providers and plan types. There are multiple providers, and each offers multiple plans with different characteristics and cost structures. So, as you can probably tell, this isn't going to be the easiest journey. Understanding the different combinations of providers, plan types, and their unique characteristics can be confusing. But we are going to break it down, step by step, to make it much easier to follow. The first step is understanding which providers you have access to. Once that's clear, you can compare their plans using the total annual medical expense chart we introduced earlier. If you're already familiar with providers and plan types, feel free to skip ahead to Series 4, where we compare real-world examples. This chart shows where people living in the U.S. get their health insurance from. The majority of health insurance coverage for U.S. residents is provided by 5 main providers. 1. Employer-sponsored insurance, or ESI. 2. COBRA, temporary continuation of ESI. 3. ACA Marketplace, also called Obamacare. 4. Medicaid, for low-income individuals. And 5. Medicare, for people over 65 or with certain disabilities. Employer-sponsored insurance covers 48.8% of the population. Medicare covers 18.9%. Medicaid 17.9%. ACA Marketplace plans 5%. COBRA 0.5%. Together, these 5 providers cover about 91% of the U.S. population. So let's go through the 5 providers one by one. Provider 1. The first provider we'll cover is employer-sponsored insurance, or ESI in short. Most people living in the U.S. get insurance through their jobs. Employers pay part, majority in most cases, of the premium, and employees pay the rest, usually through payroll deductions. Enrollment is limited to when you're first hired, during an annual open enrollment period, after a qualifying life event like marriage or birth. ESI is a cost-effective option if available, since employers subsidize a large share of the premium. Provider 2. COBRA is a system that lets you keep your employer plan for a limited time, usually 18 months, after leaving a job. But it's expensive. You pay 100% of the premium plus a small fee. To give you an idea of what this means, here's a real-life example of the premium that had to be paid for an ESI when switched to COBRA. ESI premium was $509 per month, and the COBRA premium for the same plan became $1,623 per month when switched. The large number under COBRA is because you're paying the portion your employer used to cover. COBRA can still be useful if you're mid-treatment, want to keep the same doctors, have cleared the deductible, etc. But again, it is expensive. So if you have other options, it would make sense to move away from COBRA as quickly as possible. COBRA enrollment is event-driven, not tied to open enrollment, triggered by qualifying events like job loss, reduced hours, death, divorce, or a child losing eligibility. A 60-day election window opens from the event date or COBRA rights notification, whichever is later. Provider 3. The next provider is the Affordable Care Act Marketplace, or ACA Marketplace. This is also known as Obamacare. If you don't have access to employer insurance, you can buy coverage through healthcare.gov or your state's marketplace. Health insurance plans available through the ACA Marketplace vary by state and insurer, focus on in-network providers, rarely cover out-of-network care, except emergencies, and may qualify you for income-based subsidies. The income-based subsidies is the key here. It's an aid provided by the state and can significantly lower your monthly premium, making ACA Marketplace plans much more affordable, especially for individuals and families with moderate incomes. The amount of subsidy you receive depends on your household income and size, and it is directly applied to reduce your premium. Marketplace plans primarily utilize in-network providers. Therefore, It's essential to verify if your current doctors or ongoing medical services are within the Marketplace Plans network to ensure coverage and prevent increased out-of-pocket expenses. While out-of-network services are rarely covered by Marketplace Plans, medical emergencies are an exception and will be covered. Plans available through the ACA Marketplace differ by state, as each state may have its own marketplace and a unique set of participating insurance companies and plan offerings. This means the specific plans, benefits, and costs can vary significantly depending on where you live. Enrollment is limited to open enrollment between November and January or a qualifying life event. Provider 4. Medicaid is a government-funded health insurance program for people with limited income and resources. Although it is publicly funded, many states contract with private insurers called Managed Care Organizations, MCOs, to administer Medicaid benefits. These MCOs are often well-known insurers. In fact, the same insurers that run Medicaid MCOs may also offer employer-sponsored insurance and ACA Marketplace plans. The difference is that ESI and AC plans are purely private coverage, while Medicaid is governed by state and federal rules. Medicaid eligibility, benefits, and rules vary by state and are generally based on income, household size, and specific eligibility categories such as pregnancy, disability, or age. Because it's a government-funded program for low-income individuals, Medicaid typically has no or very low monthly premiums, deductibles, or out-of-pocket costs. While it covers a broad range of services, not all doctors accept Medicaid. If you are enrolled in Medicaid, you will have to find medical service providers who accept Medicaid. But in a true medical emergency, Medicaid must cover your treatment at any hospital, regardless of whether that hospital is in your plan's network. This is a critical protection guaranteed by federal law that all state Medicaid programs must follow. Each state runs its own program, so eligibility and coverage vary. There's no limited open enrollment. You can apply anytime during the year. Provider 5. Medicare is another government-sponsored insurance program. It covers seniors age 65 and older, and younger individuals with certain disabilities. It's split into 4 parts. Part A, for hospital care. Part B, for outpatient and doctor visits. Part C, for Medicare Advantage, which is a bundled coverage offered by private insurers. And Part D is for prescription drugs. Part A and Part B is called Original Medicare. One of the main choices you'll face is whether to stay with Original Medicare or enroll in Part C, Medicare Advantage. If you choose Original Medicare, it's common to add Part B for prescription drug coverage. With Medicare Advantage, drug coverage is usually already included, so a separate Part D plan is typically unnecessary. So Medicare gives you the flexibility to choose between a government-based Original Medicare option and a private insurance-based Medicare Advantage option. To enroll in Medicare Advantage, you must already have both Part A and Part B. The basic Medicare Advantage premium is tied to Part B, but some plans include extra benefits that come with an additional cost. Be sure to review the details carefully so you know exactly what you're paying for before enrolling. While we won't go into all the details, here's a quick view of how premium, deductible, and out-of-pocket max apply. For Part A, the premium will be $0 if you have paid Medicare taxes for more than 10 years. For Part C, Medicare Advantage, the premium will be paid via the Part B premium, and there will normally be no premium to pay to the private insurer. But as said earlier, there could be additional premium required by the private insurer if additional coverage is added. Now, the biggest risk on Original Medicare. You can see that there is no out-of-pocket maximum. While your coinsurance is usually 20% without an out-of-pocket max, a major illness could lead to catastrophic costs. In order to mitigate this risk, many people enrolled in Original Medicare purchases another insurance called the Medigap. So going with Original Medicare, if you want to have out-of-pocket maximum protection, there will be an additional out-of-pocket cost for Medigap you'll be paying for. That should be considered in your total annual medical expenses. In addition, it's important to note that Original Medicare primarily covers services within the U.S. and typically does not include routine, vision, dental, or hearing care. This can be a significant gap, especially for seniors. In contrast, the Part C Medicare Advantage plans offered by private insurers often bundle additional benefits such as vision, dental, and hearing coverage. And, importantly, they include an annual out-of-pocket maximum, which original Medicare lacks. This difference in coverage and financial protection has contributed to a growing trend where more and more Medicare-eligible individuals are choosing Medicare Advantage plans for their broader benefits and greater cost predictability. The proportion of individuals opting for Medicare Advantage has consistently risen over the past 2 decades, increasing from approximately 10% to more than 50%. Medicare enrollment happens during a few key windows. The initial enrollment period around your 65th birthday over a 7-month period. The annual enrollment period from October 15th to December 7th to change coverage for the next year. And the Medicare Advantage open enrollment from January 1st to March 31st for a one-time plan switch. That concludes our review of the 5 insurance providers. To summarize, Medicaid and Medicare generally offer the most comprehensive and lowest cost options for those who qualify. For individuals not eligible for these programs, employer-sponsored insurance is typically the next most cost-effective solution, as employers often cover a substantial portion of the premium. COBRA is generally more expensive because you pay both your share and your employer's share of the premium, but it can serve as a temporary bridge if you lose job-based coverage. ACA Marketplace plans can also fill the gap, especially if you qualify for income-based subsidies that reduce premiums and out-of-pocket costs.